An amiable welcome to everyone. This is your Allied Lecdem channel to enhance your understanding. Today we are going to see about continuous renal replacement therapy. Continuous renal replacement therapy is a therapy indicated for continuous solute removal or fluid removal in critically ill patient. It allows for slow and isotonic fluid removal that results in better hemodynamic tolerance even in unstable patients with shock and severe fluid overload. This process can be applied to both adults and children. CRRT can be modified at any time of the day and night to allow the adaptation to the rapidly changing hemodynamic situation of critically ill patients. CRRT therapy indications may be renal, non-renal or combination of both. The goals of CRRT are removal of waste products, restoration of acid-base balance, correction of electrolyte abnormalities, hemodynamic stabilization, fluid balance, nutritional support, and removal or modulation of septic mediators. The indications of CRRT are oliguria or anuria, hyperkalemia, severe acidemia, severe volume overload, uremic encephalopathy, severe dyspnea, hyperthermia, drug overdose with dialysable toxins, large volume of blood products or other fluids. The non-renal indications are fluid overload, sepsis, thermoregulation, hepatic failure, osmoregulation, acute pancreatitis, etc. The principles of CRRT are diffusion, convection, ultrafiltration and adsorption. The diffusion is movement of solutes through a semi-permeable membrane from an area of higher concentration to an area of lower concentration until equilibrium has been established. The convection is one-way movement of solutes through a semi-permeable membrane with water flow. Sometimes it refers to a solvent drug. Next, the ultrafiltration. Ultrafiltration is the movement of fluid through a semi-permeable membrane along a pressure gradient. Next, adsorption. Adsorption is the adherence of solute and biological matter to the surface of membrane. The CRRT include several treatment modalities that use a veno-venous axis. The choice will depend on the needs of the patient and on the preference of the physician. Slow continuous ultrafiltration. The goal is safe management of fluid removal, and the indication for slow continuous ultrafiltration is fluid overload with significant electrolyte imbalance, and the principle used is ultrafiltration. The therapy characteristics are no dialysate or substitution solutions used, only fluid removal. Continuous VENO-VENOUS HEMOFILTRAtion, and the goal for continuous VENO-VENOUS HEMOFILTRAtion is solute removal and safe management of fluid volume, and the indication is uremia, severe acid-base or electrolyte imbalance when removal of larger molecular weight substance is required, and the principle used is convection. The characteristics are it requires substitution solution to drive convection and no dialysate solution is used, effective at removing small and large molecule. Continuous VENO-VENOUS hemodialysis. The therapeutic goal is solute removal and safe management of fluid volume. Indications are uremia, severe acid or base or electrolyte imbalance, and the principle used is diffusion, and the characteristic is it requires dialysate solution to drive diffusion. No substitution solutions are used, effective at removing small to medium molecules. Continuous VENO-VENOUS hemodiafiltration, and the goal is solute removal and safe management of fluid volume, and the indications are uremia, severe acid or base or electrolyte imbalance when removal of larger molecules weight substance is required, and the principle used is diffusion and convection, and the characteristic is it requires dialysate fluid and substitution solution to drive diffusion and convection, effective at removing small, medium and large molecule. The anticoagulation used are heparin, low molecular heparin, regional citrate anticoagulation, regional heparinization, heparin, direct thrombin inhibitors, saline flush, prostacyclin, and the activated protein C. Next, the choice of anticoagulation in CRRT patients, the characteristic of the patients and the recommendation of the anticoagulation. For low bleeding risk, we use citrate, heparin, low molecular weight heparin. For high bleeding risk, citrate, no anticoagulation. Active bleeding, no anticoagulation. HIT, citrate, and arcatroban. Hemofilter. It blood flows inside of the hollow fiber. Dialysate flows on the outside of the fiber. Solute and fluid removal will be determined by the type of membrane and surface area. Hemofilters are usually synthetic. The hemofilter is a requirement of any CRRT system. It is referred as artificial kidney. The hemofilter contains a semi-permeable membrane in a hollow fiber design. The accessories are other accessory products may be used in CRRT settings. They include drainage bag, 3-way or 4-way adapter, stopcocks, syringes, anticoagulant, primary solution, and dual lumen catheters. The substitution solution, and the primary function for this is removes of solute through convection, that is small, medium, large molecules, does not affect the patient's intravascular volume, may be physiological from an electrolyte standpoint and sterile. They must be labeled for IV use. Can be pharmacy prepared infused to the patient blood pre-dilution, post-dilution or both. And formulation, volume and infusion method pre or post solution are prescribed by a physician. Substitution solutions allow convective clearance. The volume of substitution solution infused is automatically removed by the machine, sometimes referred to as replacement fluid. Next, the dialysate solution, and the primary function is removal of solute through diffusion. Only the small molecules can be removed. It does not affect the patient's intravascular volume, may be physiological and should be in sterile, prescribed by a physician. Dialysis solution allows diffusive clearance. Infused into external dialyzer part of the hemofilter countercurrent to the blood flow. Vascular volume of dialysate solution infused is automatically removed by the machine. Formulation is usually calcium free when used with citrate anticoagulation. Thank you.